My name is Squadron Leader Anish Chawla, retired. Also Captain Anish Chawla. When I was in the Air Force flying fighters, I was later flying commercial jets. When my vision started deteriorating a bit in the last 6 months, it was noticeable to me that I was having a bit of double vision. I had problems at night driving with the halo effect. So I called up Dr. Pakrasi at Medanta and I asked him for an appointment to come in and see him regarding a consultation for my eyes.
He had come with a diminution of vision in both his eyes and he was unable to fly any longer. So on examination, he had significant changes of cataracts in both the eyes at the age of 65. And he was looking for a very quick recovery because he lives in Switzerland. So he came and we took him up for the 4D refractive cataract surgery, which was done one eye yesterday. The second eye has been done today. And he has taken about 3 minutes for the entire procedure, which is done without any kind of anesthesia or any blockage.
He recommended that I change my lens with the laser machine, and since Medanta had a brand new machine which had just come in.
He was taken up for the 4D cataract surgery, which is an absolutely brand new technology which has been introduced in the world. This is the first installation in India. The basic advantage of this machine is that it actually optimizes the amount of time taken, the amount of energy used to pulverize the cataract, to remove the cataract and keep the anterior chamber absolutely stable during the surgery.
If you focus at my eyes at the moment, you'll see my left eye is still dilated, as well dilated as compared to my right eye, which was operated yesterday. It's back to normal.
So there has been no patch, bandage or any dark glasses or any restriction which he needs to follow after surgery. He is fit to go back home and resume all his activities as usual, as normal. And he already is saying immediately after surgery that his vision is absolutely clean and clear and he's able to function fully without any problems.